on every level of um, communication. So on a national and a local level, and even on a personal level with providers, I think that we can all improve how we're communicating, why social distancing practices are important, why we're asking people to wear masks when they go outside their homes, um, why you have to self quarantine, why businesses are going to still be closed, how COVID is being transmitted within a community, what risks you might have for severe disease, and that might be it may be more true for minority populations. You know, it's hard to say because we're learning about COVID in real time, and I think we all forget that this pandemic is only 3 months old, and so even our understanding of how COVID is impacting minority communities, that's new. You know, that's within the last 2, 3, 4 weeks, and so learning that and then pivoting with it in a sort of significant enough way that we can get the message out well. I think that's still something we need to work on really as a medical community locally and at large. I think that minority populations in general have health disparities when it comes to things like preventative medicine, getting the right vaccines, um, healthy lifestyle choices, making healthy lifestyle choices, having the counseling to do those sorts of things, um, smoking cessation, diet modifications, getting your diabetes really well under control, getting your diabetes diagnosed in the first place. All of these different things, I think, um, are struggles within minority communities and sort of evidence of the health disparities. And you're right, COVID-19 um, is just making that super, super clear. He said it really reflects a couple of things. One is exposure. I think that minority populations, a lot of them are the so-called like essential workers. They're working in our grocery stores and they are here in the hospital system, um, providing a lot of support services to the medical center so that other we can keep functioning and do the job we need to do. So I think exposure is a big part of that. For a myriad of reasons, I think minorities are having higher exposure rates. I also think that minorities, at least in my experience, and I can say this as a minority, tend to live in congregate settings. We live in multi-generational family homes. Um, I have quite a bit of personal experience. I was telling my family just the other day that I think we've sacrificed a lot personally to COVID-19 as I've seen it sort of make its way through my family in New Jersey. And a lot of that is sort of like fathers getting sick and then passing it on to or younger sons in their 30s getting sick and passing it on to their older fathers. And then fathers ending up in the ICU. So, I think, that's another sort of part of it that, it's not easy to mitigate with rules and regulations. And then there may be some part of this where there is a racial predisposition. It's really hard to measure how much race actually has an impact as opposed to some of these other things. Like I said, as like, congregate living situations, exposure rates, um, health disparities. So certainly all those things are playing a role, and how much on top of that race is also contributing, it's hard to say. But it wouldn't be completely outside of the box to think that there may be some component that's really related to race and genetic disposition and so forth. And then we're seeing that a lot of patients with really severe disease have underlying comorbid conditions like diabetes and hypertension and heart disease. And chronic pulmonary conditions. And I think, unfortunately, those are things that are um, prevalent in minority communities, particularly diabetes. If I wasn't in healthcare and I was, just in the community as a minority, I would sort of be wondering, given all we've discussed about things like health disparities and representation of minorities in healthcare and in medicine and their access to care and how to reach them, I would sort of be wondering who to trust and which information to trust. And there's so much media, you know, there's local and statewide and national media, and then there's things online, and there's all sorts of people giving you all sorts of directions, and sometimes it's very conflicting and confusing. Um, so my message to them is the same thing that I tell my own family, which is that you know, we have to take this seriously as a community. It is sort of, you know, sort of moving through minority communities like a tornado. And it's affecting generational families, multiple generations within a family. And you're going to, um, you know, social distance and wear mask when you go out to the Family Dollar, not just for yourself, but for your mom and your grandmom. Um, and that, um, yeah, don't try home remedies. Go to the doctor if you're feeling sick. You know, just take it seriously, because you know, in my minority community, my family is the most important thing. Um, and so I think that I'm not just thinking about myself, I'm thinking about my family. And what I do can affect them. So I'm going to take it as seriously as I can. Not just, you know, I may be invincible, I'm young, I'm in my 30s, but my mom and dad aren't. And so I'm going to go that extra distance and do the ridiculously excessive thing, even if I don't quite understand all the ins and outs of it, for their sake. Yeah.